everyone, welcome back to our channel Nucleus. I hope you guys are watching our videos as we are trying to get in touch with you people through our channel. Till now you have seen about the different life process, the organ involved in it and how they work. In today's video I'm going to show you about some disease which is very common among human beings. So let's get started. The first disease we are talking about is cardiac arrest. Cardiac arrest is a condition in which the heart has stopped beating or beats too inefficiently to generate a pulse. So, the heart cannot pump blood to the brain, lungs and other organs. So, let us see what happens after a person gets a cardiac arrest. Few seconds after a person gets cardiac arrest, the person becomes unresponsive. That is completely not breathing or just gasping. Death may occur within a minute if proper treatment is not provided to the person. Now, let us see what causes cardiac arrest. It occurs when the heart muscles get thicker than its usual or gets completely damaged because of the high blood pressure. It may also occur due to abnormalities shown by the blood vessels, more precisely the coronary blood vessels and the aorta. Number 2 is asthma. It is a condition in which a person's airways become inflamed, narrow and swelled and produce extra mucus which makes it difficult to breathe. Now, what happens when a person gets an asthma problem? A person may cough, wheeze and have trouble in breathing along with chest pain. Severe asthma attack can be life-threatening. So, those from you get severe asthma, please go and check it out with a doctor. Now, let us move towards what causes asthma. The first and the foremost causes may be due to respiratory infection, which is common cold. Air pollutants and irritants like dust and smoke also causes asthma. Number 3 is high blood pressure or hypertension. Basically, blood pressure is the force with which the blood travels throughout the body. Now, the condition in which the force of the blood against the artery wall is too high is called hypertension. It is when the systolic pressure is 140 mmHg or above 140 mmHg and the diastolic pressure is 90 mmHg or above 90 mmHg. Now, let us move towards the consequence of having high blood pressure. High blood pressure can lead to rapid loss of brain function or causes brain stroke. It also damages the blood vessels in the retina, resulting in loss of vision. High blood pressure can result in heart attack and kidney failure. So, what are the main causes of high blood pressure? One of the major causes of high blood pressure may be family history. Overweight or obesity, excessive intake of alcohol, excessive consumption of salt can also lead to hypertension. Number 4 is anemia. Anemia is a condition in which the blood does not have enough healthy red blood cells or the hemoglobin concentration within the blood cell is very low. Now, let us discuss what happens when a person has anemia. During anemia, red blood cell cannot carry adequate amount of oxygen to the body tissues. Having anemia can make a person feel tired and weak. It might include fatigue, shortness of breath, headache, etc. Anemia may cause due to various reasons. It may occur due to huge amount of blood loss, or it may also occur due to decrease or destruction of RBC. Some of the most important other reasons may be ulcer, hemorrhoids, gastritis, and cancer. Sometimes it can be seen that if a woman bleeds too much during their menstruation, it also results in anemia. Number 5 is diabetes mellitus. Diabetes mellitus is a disorder in which blood sugar or glucose level are abnormally high, because of the body does not produce enough insulin to meet the need. Now, what happens when a person goes through diabetes mellitus? During diabetes mellitus, urination and thirst are increased and people may lose weight even if they do not want to. Diabetes also damages blood vessels and increase the risk of heart attack, stroke, chronic kidney disease and vision loss. Now, what causes diabetes mellitus? The main reason of diabetes mellitus is when the pancreas releases very less insulin hormone. This may be due to family history of having diabetes. Diabetes may also occur if the person suffers from obesity and high blood pressure. Being aged, bad food habit may also trigger the process of getting diabetic. Number 6 is gastric ulcer. Gastric ulcer is a sore that develops on the lining of the esophagus, stomach or small intestine. Among all, stomach ulcer is the most common one. This occurs when the thick layer of mucus present in our stomach gets reduced. This happens when the digestive acid, that is HCl, corrode the tissue that lines the stomach. Now, what happens when a person has stomach ulcer? The person suffering from stomach ulcer may feel pain in the stomach along with nausea and vomiting. The person may also feel bloated and will also have heartburn and acid reflux. Now, the question arises, what mainly causes gastric ulcer? Stomach ulcer may cause of various reasons. Among all, peptic ulcer caused due to the attack of bacterium Helicobacter pylori is the most common one. Some other causes include intake of some anti-inflammatory medicines like aspirin, naproxen, ibuprofen, etc. Number 7 is gallstone. Gallstones are hardened deposits of digestive fluids that are observed in the gallbladder. A person who have gallstone may go through the following discomforts. The person may feel pain in the upper right abdomen, below the right shoulder and between the shoulder blades. The person may also feel nausea or vomiting. Now, what causes gallstone? Gallstone may occur if the bile contains too much of cholesterol and bilirubin. Gallstone may also occur if bile gets deposited in the gallbladder. Number 8 is constipation. Constipation occurs when the person has difficulty in emptying the large bowel. The person who is suffering from constipation may find difficulty in passing out stool, straining when passing stool along with pain and cramping in the abdomen. The person may also have rectal bleeding due to excessive strain during passing of stool. Constipation may occur if a person has deficiency of dietary fibers in the diet. Less physical activity may also lead to constipation. Number 9 is scurvy. Scurvy is a disease resulting from a lack of vitamin C or ascorbic acid. Now let us see what happens to a person having scurvy. The person may have bleeding and swelling of gums, including joint pains, particularly in legs. The person may also feel weak and get red rashes on skin. Now let us see how a person gets scurvy. Since human cannot synthesize vitamin C, its deficiency causes scurvy. The several other factors include consumption of drugs or alcohol, mental health conditions like depression, unhealthy diet, etc. Number 10 is goiter. Goiter is a swelling in the neck resulting from an enlarged thyroid gland. Now, what happens to a person having goiter? The person may have swelling in the front of the neck just below the Adam's apple. The person may also have a feeling of tightness in the throat area. It might include swelling in the neck veins, hoarseness or scratchy voice, coughing, difficulty in breathing, and difficulty in swallowing food, etc. Now, what causes goiter? Basically, simple goiter develops when the thyroid gland does not have enough hormones to make the body sneeze. Goiter may also occur due to lack of iodine in our diet. With this, we have came to an end of class 10's first chapter, that is life process. Keep watching our videos for more interesting topics. Till then, subscribe to our channel, share it with maximum audience. Thank you.